The human brain is the most complex organ in our body. It is your body's command center. Think of it as a sophisticated biological computer. It manages everything from your thoughts and memories to your movements and emotions. This 3-pound marvel of tissue and nerve cells is responsible for who you are. Every idea you've ever had, every song you've ever loved, and every face you recognize is processed within its intricate folds. It is protected by the hard bone of the skull and cushioned by a clear liquid called cerebrospinal fluid. This protection is vital because the brain is incredibly delicate, yet it works tirelessly every second of every day, even when you are fast asleep. It controls not just the conscious actions we choose to make, but also the countless unconscious processes that keep us alive, like breathing and our heartbeat. To understand the brain, we often divide it into major parts. The largest part is the cerebrum. This is the classic wrinkled outer part you often see in diagrams. The cerebrum is divided into 2 halves or hemispheres. The right hemisphere generally controls the left side of the body, and the left hemisphere controls the right side. These hemispheres are further divided into 4 lobes, each with specialized functions. The frontal lobe is for thinking and planning. The parietal lobe processes sensory information like touch and pain. The temporal lobe is crucial for hearing and memory, and the occipital lobe is dedicated almost entirely to vision. Together, these parts form the core of our conscious experience and our ability to interact with the world around us. Below the cerebrum sits the cerebellum. Its name means little brain, and it looks like a smaller version of the cerebrum. While the cerebrum handles the what of our actions, the cerebellum handles the how. It is essential for balance, coordination, and fine motor control. Think about signing your name or catching a ball. These precise, smooth movements are orchestrated by the cerebellum. It fine-tunes the commands sent from the cerebrum, ensuring our actions are graceful and accurate rather than clumsy and jerky. It learns from practice, which is why tasks like riding a bicycle become easier and more automatic over time. The cerebellum is a testament to the brain's incredible ability to manage complex physical tasks without our conscious effort. Finally, connecting the brain to the spinal cord is the brainstem. This is the most ancient and fundamental part of the brain. It is responsible for the essential functions that keep us alive. These are the automatic processes we rarely think about. The brainstem controls our breathing rhythm, heart rate, blood pressure, and even our sleep-wake cycles. It acts as a relay station, passing messages between the upper parts of the brain and the rest of the body through the spinal cord. Without the brainstem, the higher functions of the cerebrum would be useless. It is the foundation upon which our consciousness and our very existence are built, a silent, powerful engine running the machinery of life. The brain works through a complex network of specialized cells called neurons. There are billions of these neurons in your brain. They communicate with each other using tiny electrical and chemical signals. Imagine a vast, interconnected network of wires. When you think, feel, or move, an electrical impulse, called an action potential, travels down a neuron. When it reaches the end, it releases chemical messengers called neurotransmitters. These chemicals cross a tiny gap called a synapse to reach the next neuron, passing the message along. This process happens at incredible speeds, allowing for rapid communication throughout the brain. This constant firing and wiring of neurons is what allows us to learn, form memories, and perceive the world in real time. In our daily lives, this neural communication is happening constantly. When you wake up, your brainstem signals that it's time to be alert. As you decide what to eat for breakfast, your frontal lobe is engaged in planning and decision-making. The sight and smell of coffee are processed by your occipital and temporal lobes, respectively. The simple act of lifting a cup to your lips involves a coordinated effort between your cerebrum, which initiates the command, and your cerebellum, which fine-tunes the movement for precision. Every thought, every sensation, and every action is the result of millions of these neural signals firing in specific patterns. This symphony of activity is what creates the seamless experience of our conscious reality. But what happens when this intricate system is disrupted? A brain tumor is one serious condition that can interfere with normal brain function. A tumor is an abnormal mass of cells that grows uncontrollably. In the confined space of the skull, even a small tumor can cause significant problems. It can press on surrounding brain tissue, disrupting the delicate flow of electrical and chemical signals. This pressure can damage healthy neurons or block the pathways they use to communicate. depending on its location, a tumor can affect specific functions. For example, a tumor in the occipital lobe might cause vision problems, while one in the frontal lobe could lead to changes in personality or difficulty with planning. The symptoms of a brain tumor are often related to its location and size. The pressure it creates inside the skull, known as intracranial pressure, can lead to general symptoms like persistent headaches, nausea, and vomiting. These headaches are often worse in the morning and may not respond to typical pain relievers. Specific symptoms depend on which part of the brain is affected. A person might experience seizures if the tumor irritates the brain's electrical activity. They could have weakness or numbness in a limb if it presses on motor or sensory areas. Problems with speech, memory, or balance are also common. It is the disruption of the brain's normal, organized function that produces these varied and often distressing symptoms. A brain tumor is defined as a growth of abnormal cells within the brain. Our bodies are constantly replacing old cells with new ones in a controlled manner. However, sometimes this process goes wrong. Cells may start to divide without stopping, or old cells may not die when they should. This out-of-control growth forms a mass, or tumor. Brain tumors can be categorized in two main ways. They can be benign, which means they are not cancerous and tend to grow slowly. Or they can be malignant, which means they are cancerous, grow more aggressively, and can invade nearby brain tissue. Both types can be serious because the skull is a fixed space. Any extra growth increases pressure on the delicate brain tissue. Tumors can also be classified as primary or secondary. A primary brain tumor is one that starts in the brain itself. These tumors arise from the brain cells or the membranes surrounding the brain, called the meninges. There are many different types of primary brain tumors, and they are named after the type of cell from which they originate. For example, gliomas are tumors that grow from glial cells, which support and protect neurons. A secondary brain tumor, also known as a metastatic brain tumor, is different. This type of tumor starts somewhere else in the body, such as the lung or breast, and then cancer cells travel through the bloodstream to the brain, where they form a new tumor. Secondary brain tumors are actually more common than primary ones. The exact causes of most primary brain tumors are not well understood. For most patients, there is no clear reason why they developed a tumor. However, researchers have identified a few risk factors that may increase a person's chances. The most significant known risk factor is exposure to high doses of ionizing radiation. This is most often from radiation therapy used to treat another cancer, especially if the treatment was given during childhood. In a very small number of cases, a person may inherit a genetic syndrome that makes them more susceptible to developing brain tumors. Conditions like neurofibromatosis or Li-Fraumeni syndrome are examples of these rare inherited disorders. It's important to dispel some common myths about what causes brain tumors. There is currently no strong scientific evidence to link brain tumors to lifestyle factors like diet or stress. Similarly, extensive research has not found a definitive link between cell phone use and an increased risk of developing a brain tumor. While scientists continue to study potential environmental and genetic causes, for the vast majority of people, a brain tumor diagnosis is the result of a random, unfortunate cellular mistake. It is not caused by anything the person did or did not do. Understanding this can help alleviate the misplaced guilt that patients and their families sometimes feel when facing this challenging diagnosis. When a brain tumor is diagnosed, a team of doctors will recommend a treatment plan based on several factors. These include the tumor's type, size, grade, how aggressive it is, and location. The patient's overall health and age are also very important considerations. The main goals of treatment are to remove or destroy as much of the tumor as possible, relieve the pressure it is causing inside the skull, and manage symptoms. The three primary methods used to treat brain tumors are surgery, radiation therapy, and chemotherapy. Often, a combination of these treatments is used to achieve the best possible outcome. Each approach has its own specific role in the fight against the tumor. Surgery is often the first line of treatment, especially for tumors that are accessible. The goal of a neurosurgeon is to perform a craniotomy, which involves temporarily removing a piece of the skull to access the brain. They will then attempt to remove as much of the tumor as possible without damaging the surrounding healthy brain tissue. This is called a resection. For some benign tumors, complete removal through surgery might be the only treatment needed. For malignant tumors, removing the bulk of the tumor can relieve pressure and make other treatments like radiation or chemotherapy more effective. Modern surgical techniques like brain mapping and image-guided surgery help surgeons operate with incredible precision. Radiation therapy is another powerful tool. This treatment uses high-energy beams, such as X-rays or protons, to damage the DNA of tumor cells, which stops them from growing and dividing, eventually causing them to die. Radiation can be delivered in a few different ways. It can be aimed at the entire brain or focused very precisely on the tumor itself. A technique called stereotactic radiosurgery, or SRS, uses many small, highly focused beams of radiation to target the tumor from different angles. This delivers a high dose to the tumor while minimizing exposure to the surrounding healthy tissue. Radiation is often used after surgery to destroy any remaining tumor cells or as the main treatment if surgery is not possible. Chemotherapy involves using powerful drugs to kill cancer cells. These drugs are typically given orally as a pill or intravenously through an IV line. The drugs travel throughout the bloodstream to reach cancer cells in the brain and other parts of the body. This makes it a useful treatment for tumors that have spread or for those that cannot be completely removed with surgery. However, the brain is protected by something called the blood-brain barrier, a protective membrane that can stop many chemotherapy drugs from reaching the tumor. For this reason, doctors must use specific drugs that are known to cross this barrier, or sometimes place the chemotherapy drugs directly into the tumor site during surgery. If you need medical attention, please consult with your doctor.